Welcome to the Medical Ancillary Sales Podcast, your number one source for making money in the medical ancillary sector. Mike and Viv bring you the latest information from lab services, pharmacy, diagnostic testing, and so much more. The latest in ancillary services will be right around the corner. Welcoming the hosts of the Medical Ancillary Sales Podcast, here's Mike and Viv.
Hello and welcome to the Medical Ancillary Sales Podcast. I'm your host, Mike, and joined as always by Viv Hudson. Viv, how you doing?
I'm great, thanks, Mike. Today I'm super excited because there's non-stop action with this podcast. We've got another new exciting test, this time targeted towards women's health. And this is going to help reps out in the field get their foot in the door at OBGYN's offices. So I know that you've got probably a little bit more knowledge about this than what I have, Mike. So the test that we've got is called a FISH test. So can you tell us what is a FISH test and why would we be doing it?
So FISH test it stands for fluorescence in situ hybridization, and it's a test that maps genetic material in a person's cells. So an OBGYN would order this test to be able to get a clearer picture and more objective findings to see which patients might be at higher risk for developing uterine or cervical cancer.
Right. So what is the problem with the current method that physicians are using?
Well, it just does not give them enough of objective findings so that they know which patients are at higher risk than others. What the FISH test allows the physician to do is to get a clearer picture. So it looks at certain chromosomal abnormalities that are associated with patients who are at high risk, and it will test for those things, and it will be able to show the doctor which patients are at moderate or low risk, so they know when to schedule their patient to come back and how closely to monitor them. So as it stands now, without that tool, well, you would know, you're a woman. How often do women go in for a checkup, for a PAP? That's an annual thing?
Right. I know it's normally every 2 years, but if you have an abnormal one, then they usually get you to come back every 12 months.
Well, that's an issue of liability for the OBGYN because, as you know, these types of cancers tend to be aggressive. The cells tend to spread aggressively. And it's very important to nip it in the bud, to detect these things early on. So what this test allows the OBGYN to do is to get a clearer picture as to who really is at higher risk and be able to come up with an appropriate treatment plan for those patients. So if you do have a patient who is at a higher risk, who does have those certain chromosomal abnormalities, they may show an increased risk of developing more aggressive forms of cancer, and they can monitor those patients more closely and maybe schedule them for a 3-month checkup as opposed to an annual or every other year checkup.
Right. So this solution really has the opportunity to save patients' lives because often these cancers can be quite silent, I guess, until sometimes it's too late. So it's quite an exciting test to be representing. So what are the benefits to the physician?
Well, I can tell you, when I was a pharmaceutical rep, one of the things that they taught us, I worked for Merck, and I remember going through training, and one of the things they showed us in sales training, some of the research that they've done on selling to doctors, more than increasing the revenue or other things that you would think might be good selling points to doctors, the number one thing that a doctor will respond to is lowering their risk. If you can show how your program, your pill, your device, whatever it is, your FISH test, if you can show that this will lower risk for the doctor and reduce their liability that's a bigger selling point than walking into an office. Everyone wants to walk in an office and show the doctor a program that's going to make them $20,000 a month. I'm in the same boat. But that's not what the research has found. The research has found that this is actually a more effective selling tool, is to find programs like this that you can go to the OBGYN and say, we can show you a way to stratify the risk for your patients, identify the patients who may be at higher risk for developing cervical cancer, and you can identify those patients and hence come up with an appropriate treatment plan and lower your risk, lower your liability, lower the patient's risk of getting a cancer that's untreated, that goes untreated because they've waited too long in between appointments, and ostensibly, I would think that would lower the physician's risk of getting sued.
Right. So, and doctors like to be problem solvers. So, I mean, if they can help a patient at this early level, it really helps them to really feel that it's worthwhile them being a doctor. That's for sure. So,
no doubt, this is not a tough sell. This should be a very easy sell. The toughest sell is just getting to the physician, as you know. That's the hardest part of this sell. This panel was developed by a pathologist who has 30 plus years experience. He developed this panel. This is not something that a lot of labs offer. So chances are the OBGYNs that you will be going in to see probably are not offering this test right now to their patients. And I think if they had an open mind, and if you could get them for 3 minutes, 5 minutes to listen to what this panel offers and what this will do for their practice and for their patients, I don't see a lot of pushback.
Because what is the risk for the physician to even try it?
Zip. There's
exactly.
Yeah, the only thing you're fighting against is old habits. As you know, that's one of the biggest things that we fight being in medical sales, is you fight physicians' old habits.
Absolutely. So, and what kind of insurance? Like, obviously, this doesn't sound like it's going to be a run-of-the-mill routine test. So, how is your insurance paying out on it? And do you know what the percentage of pap smears that end up requiring this additional testing?
Well, to my knowledge, any pap smear, you could order this for any pap, and this would just be part of the routine wellness visit. And in terms of insurance coverage is good on this. Federal payers, HMO, PPO. The insurance coverage is good, and in terms of reimbursement, there's several billing codes that they're targeting here. So it's actually an IHC test, which is an immunohistochemistry test, along with a FISH. So there's two parts to it, and in the aggregate, the total reimbursement on this is in the neighborhood of anywhere from $800 to $2,000. And I'm not going to say it's 100% adjudicated. I really don't know that it's 100% adjudicated, but I also haven't heard of a high number of denials for this test either. I mean, this is preventative medicine. If you think about it, the insurance companies, yeah, they don't like to pay for things, but they'd rather pay for an $800 test than they would pay $250,000 in chemotherapy treatments and everything else that you're going to be going through if you have a patient that slips through the cracks. So this is a cost savings to the insurance companies. I can't imagine that there would be a high degree of turndowns.
Right. And from what I understand, I believe that it's about 15% of pap smears that actually display that elevated risk for these cancers that this test can actually detect. So we're not just talking 1 or 2% here. So definitely has the potential to save a lot of people's lives, a lot of women's lives. And what about the revenue for reps out in the field?
Well, it really depends on the test. So like I said, the total reimbursement on this is anywhere from $800 to $2,000. So as a rep, you're going to be making good money any way you slice it. So you're getting a percentage off of that, and it's good money. Is it the type of money where you're going to be making thousands of dollars per test? No, but you're going to be making hundreds of dollars a test, and this is not something that's going away. This is something that is that not a lot of people are offering out there. It's a true differentiator. And as a sales rep, I always look for a differentiator. I don't want to walk in there and sell something that 10 other people were already in there that day selling the doctor on the exact same thing. This is something that's different. This is something that's going to get their attention. And of course, this could lead to other ancillary programs.
Absolutely. So let me know what your 30-second pitch is going to be when you get yourself in front of a doctor.
Oh, geez, Viv, you put me on the spot here. Well, I would go in with the patient in mind, that we have a new panel. It was developed by our pathologist, who's a 30-year pathologist specifically in this sector. And our panel consists of an IHC and FISH test, which is going to give the physician objective findings so they can better identify patients who might be at high risk for developing cervical cancer. I think it's a winner right there. How about yourself, Viv? What would you do? I'm going to put you on the spot.
Okay, well, I think I would say this test will help you, the physician, who wants to give your patients peace of mind by using the latest cancer risk detection science developed by a 30-year pathologist. The test is not currently routinely performed and will help physicians identify risk and treat their patients with certainty and reduce liability and save patient lives.
Geez, Viv, it's almost like you rehearsed that one. Okay, everyone listening, forget my pitch and go with Viv's pitch. She's better. You see why she's been so successful. Yeah, I mean, it's guys, this is a great door opener, and I know I talk about door openers all the time, and it's great to go in with programs that are going to generate revenue, but sometimes that can be a turnoff for a practice, and I didn't sell with a revenue model when I started in medical sales. I sold the science, and sometimes it's more fun to sell the science, and a lot of times the offices are more receptive to that, especially if they think it's something that is going to strike a chord with the doctors. So a lot of times, you know the saying, telling ain't selling. You want to ask more questions and so something if you could get out of the front desk staffs about how do they practice medicine? Are they more on the cutting edge? Do you think this is something they'd be interested? Do you think they'd be interested in a tool that would help them better stratify the risk for their patients who may have be at high risk for developing cervical cancer? Asking questions is always better than just blurting out a statement. But of course, you're going to have OBGYNs that are going to be interested in this, and I think it's just going to be a huge winner. So I'm excited about it personally. Every OBGYN I talk to, I'm going to be bringing it up for sure, no doubt about it.
Excellent. Well, I think that's all we've got, isn't it, Mike? So
yeah, if you're interested in learning more about this program, reach out to me, reach out to Viv. We can get you information on it. We can get you whatever you need, training materials, sign-up forms for the doctors. You can email us at ancillarypodcast@gmail.com.
And then there's the LinkedIn group as well, so you can put a comment on there too.
Yes. We have that as well. And if you're listening to us, I know some people get this through YouTube. We do have, if you have an Android, we do have a Stitcher account now also. So that's a free app. You can get it on iOS or Android. Download the Stitcher app and just look for the Medical Ancillary Sales Podcast, and these episodes will automatically upload onto your Stitcher app. So thanks for the interview, Viv. I love being on the other side of it.
I'll have to put you on the spot more often.
No problem. All right, thanks everyone.